Devon Nicholson here, and we're in week 13 of my hepatitis C experimental Incivek treatment, and I'm pretty happy right now because week 12 was my last week on the Incivek medication, and it's been causing me to suffer a lot of side effects, not to mention having to ingest all that fat along with the pills and the sheer amount of pills I had to take of it every single day. So I'm happy that I'm on to week 13, because from week 13 to week 24, I am only taking my weekly interferon injection as well as my daily ribavirin pills. Now, those all have their own set of side effects, and of course, during my last hepatitis C treatment, I was only on ribavirin and interferon, and I was forced to stop treatment at week 19 due to the terrible side effects I was experiencing. But this time I'm doing everything I can, everything by the book, to make sure that I can finish this treatment. Now, I'm in front of an MMA place right now, Ronin MMA in Ottawa, and it's kind of fitting this week because I've been in a battle with my health all week. This past weekend, unfortunately, I had to go to the emergency room at the advice of my hepatitis C nurse due to it's considered a mild rash because it wasn't the deadly rash associated with the Incivek treatment, but I was absolutely covered. It looked like I had a sunburn all over my skin. There wasn't 1 inch of my body that did not have the rash, and I was completely itchy. It felt like I had bugs underneath my skin. It was an intense, horrible itch, and as I said, it got so bad I had to go to the emergency room, and they prescribed me some strong cortisone cream called Betaderm, and I've also been constantly putting oatmeal lotion on as well as calamine lotion. So between the three, it's starting to improve, and of course the Incivek's also getting out of my system, so I'm feeling better today, and hopefully the rash side effect will continue to improve. But I just want to reiterate, yes, the rash and the itching in particular has been horrible. I'd rather fight Brock Lesnar in a UFC ring any day and get punched in the face 20 times than have to experience any itching like that ever again. But it's worth it if I can get cured, because if I get cured, I can get on with my life. I can live my life not having to worry about having a deadly disease, and if I want to, I can do amateur wrestling without having to worry. I can go into MMA and actually be licensed to fight, or I can be licensed to pro wrestle pretty much anywhere in the world, again, because of course if it works, I will be cured of the hepatitis C virus and there will be no obstacles in my way. And one piece of advice that I've received over and over again about dealing with hepatitis C treatment is causes a lot of depression side effects. And one of the things medical professionals and past patients suggest is to indulge in hobbies. So what I'm doing today is indulging in one of my hobbies, something I find fun and something that I want to improve at, and that is interviewing people. And today I'm going into Ronin MMA here to interview UFC fighter Nick the Ninja of Love Denis. So it's going to be fun, and it's going to get my mind off of some of these side effects. So I'm going to go off to do that. I just want to tell everyone I'm fighting through all the side effects. I'm not going to give up. I am a fighter. I've trained with UFC fighters before. I've wrestled some of the biggest stars in pro wrestling before. I've won the silver medal at the Canadian Olympic trials in Greco-Roman wrestling. So I know a thing or two about fighting, and I'm not going to give up, and I'm going to beat my toughest battle ever. I'm going to come out on top and defeat hepatitis C. I guarantee that.